When you think of treating cancer, you think chemotherapy or radiation, but new research is changing that. Patients are seeing dramatic results with something called gene therapy.
What we're beginning to see is just very hopeful.
Think one pill a day, fewer side effects, the kind of results people pray for.
They live longer, they live less sick, they feel better for a longer period of time.
Dr. Joe Bufil is a medical oncologist at Michiana Hematology Oncology, and some of his patients are getting that kind of treatment through a clinical trial going on at the University of Michigan.
We happen to have the ability here to participate at the very earliest stages of this big revolution, here in Michiana.
Researchers have figured out what makes normal cells in our bodies become cancer cells. And because of that, they can treat the cellular flaw, which means treatments so fine-tuned, they're based on each patient's genetic makeup.
Up until very recently, cancer treatments have been very much like trial and error. You have a chemical, it seems to work in a test tube, you try it out on patients, and you hope for the best.
But with gene therapy, doctors treat specific targets. They can zero in on certain cells and try to change them or prevent them from becoming harmful. So what you get is very targeted therapy.
It's not just seems to work in a test tube, let's try it on people. It's more like, boy, this person's tumor has these flaws, we're going to go after those flaws specifically.
It's a cutting-edge shift in the way cancer's treated, and this is just the beginning.
There's a lot of uncharted territory.
But already, it's showing great promise.
Michiana Hematology Oncology is one of only a few locations across the country doing this type of treatment. Because it is still in the clinical trial phase, it's not available to everyone, but Dr. Bufil says maybe 10 years from now, it will be.